Mr. President, I appreciate the comments of my colleague from Arizona and before him my colleague from New Hampshire in pointing out what happens when you deal with a federal government insurance company. If you want to call it Federal Government Inc., whatever you want to call it, what you're essentially talking about when the federal government takes greater control of any part of our economy, certainly 1/6 of our economy with health care, which is what health care represents. $1 in every $6 of our economy is spent on health care in this country. What you typically get are fewer choices, higher costs, and that's certainly the case here, because you're going to see fewer choices. I think that most Americans realize that if the federal government has more control, more intervention, more involvement in health care in this country, that it's going to ratchet down the availability of choice and fewer freedoms for people in this country, because the federal government is going to start saying what has to be in a certain health care policy. It's going to start getting in the way of that fundamental relationship between physicians and their patients. You're going to have more and more governmental intervention, and that ultimately is something that I think most Americans have great reservations and great apprehension about, Mr. President. And in fact, I think if you look at the bills, the various bills that are before the Congress today, and there are 3 that have been reported out in the House, 2 now in the Senate, they vary a little bit in terms of the particulars, but they are consistent in terms of their overall themes. They are all going to raise taxes. They're going to raise taxes not just on the rich, not just on people with high incomes. They're going to raise taxes on ordinary Americans. All the studies bear that out. The Congressional Budget Office says that. The Joint Tax Committee says that. They're going to cut Medicare for seniors, particularly those who have Medicare Advantage. And so Medicare benefits are going to be slashed if this bill is to become law. And they're going to all lead to higher premiums. That's the remarkable thing about this legislation, is that all these bills that are before Congress right now, which propose to control costs and to lower costs for people in this country, all lead to the same result, and that is higher costs for health care in the form of higher premiums. And I want to point out, Mr. President, something that I think in the bill that the Finance Committee produced, and by the way, they are still merging these bills behind closed doors. There are a handful of people who are writing this bill. Contrary to the assertions of the President last year when he was campaigning that this was going to be on C-SPAN, it was going to be a wide-open process, the American public was going to be able to participate and engage in this. This is all occurring behind closed doors. The specifics of this legislation are being written right now and probably going to end up in being hundreds of pages, perhaps even thousands of pages, but they all come back to the basic characteristics that I mentioned earlier: higher taxes and Medicare cuts and higher premiums for Americans. Now, what's interesting about this chart, Mr. President, is there are Americans who would be put into an exchange that would be able to get some subsidies to help purchase insurance. And obviously there are a lot of people in this country who don't have access to insurance today, and that is what we all, members on both sides of the United States Senate, want to address. How do we provide access for more Americans to affordable health care in this country? So there are some who get subsidies and would be able to buy insurance through an exchange. That's about 18 million Americans. But if you're among the 185 million Americans who currently have health insurance today, you pay higher taxes and your premiums end up going up. Now, what's ironic about this is 18 million Americans will get subsidies through these exchanges, but there are still 25 million Americans under the Finance Committee bill that don't have insurance when this is all said and done. So you actually have more people without insurance that actually would get subsidies under this plan that's being proposed by the Finance Committee, financed by the 185 million people who are going to pay higher taxes and also going to see their premiums go up. Now, I'm not saying that. That's what the Congressional Budget Office, that's what the Joint Tax Committee have said, that's what every independent study that has looked at this has said. And by the way, last week there was an analysis that came out done by the actuary at the Department of Health and Human Services here in Washington, D.C., that said that overall spending on health care under this proposal, and I say this, the House proposal, and again, they're very similar in their characteristics, some of the particulars they differ, but in the House proposal would go up by 2.1%. Now, if you remember that today we spend about 1 in 6 of every dollars in our economy on health care, at the end of the 10-year period, according to the actuary at the Department of Health and Human Services, we're going to be spending more than 1 in 5. 21.3% of every dollar in this country in our economy is going to go to health care, because under these proposals, health care costs are going to go up over and above the rate of inflation. In other words, if we do nothing today, you're going to have normal inflationary health care costs, which are going to increase the cost of health care in this country. Enacting this legislation would increase the cost of health care 2.1% above that, or $750 billion over 10 years. That's what the actuary at the Health and Human Services Department said. $750 billion in spending on health care in this country, above and beyond what would be normal if we did nothing, health care inflation in this country. So 2.1%, it would add to the GDP, or the amount that we spend in this country as a percentage of our GDP, to where 21.3% of our entire economy would be spent on health care. So you've got health care costs going up. You've got taxes going up, according to the Congressional Budget Office and the Joint Tax Committee, on people who are making less than $200,000 a year, and even half of the tax burden, over 50%, according to the Joint Committee on Taxation, would be borne by those who make less than $100,000 a year. And the amazing thing about this is, there's even the analysis that's been done that someone who's making 150% of poverty in this country, which is $32,200 a year, because of the way the provisions in this bill would interact, actually ends up with an effective marginal tax rate of 59%. 59% tax rate, because they lose subsidies as they make more money. And so the incentive for someone in a lower income category in this country to make more money is going to go away, because every dollar that they make, their effective marginal tax rate is going to go up. 59% for someone making $32,200 in this country today. That's 150% of the poverty level. And so to suggest for a minute that these tax increases and these tax policies and the way that this bill is financed isn't going to impact average Americans, working class Americans, is just absolutely wrong. It's false. And that's what the Joint Tax Committee and that's what the Congressional Budget Office have all said. But probably the worst thing, if you're one of these 185 million Americans right here who are paying the burden in the form of higher taxes, is that you're going to see at the end of all this, after all the promises about we're going to get costs under control, your health care costs are going to go up. So your taxes go up. If you're a senior citizen, your Medicare benefits go down. and guess what? Your health care costs, your insurance premiums are going to go up. That's what's been said consistently. I mean, you look at Doug Elmendorf, the director of the Congressional Budget Office, said our judgment is that piece of the legislation would raise insurance premiums. He goes on to say, those projected premium amounts include the effect of the fees that would be imposed under the proposal on manufacturers and importers of brand-name drugs and medical devices, on health insurance providers, and on clinical laboratories. Those fees would increase costs for the affected firms, which would be passed on to purchasers, and ultimately would raise insurance fees by a corresponding amount. That's a direct quote from the Congressional Budget Director, Doug Elmendorf. Now, he also said, when asked the question about would these taxes be passed on in the form of higher premiums, that roughly dollar for dollar they would be passed on in the form of higher premiums. Some of the independent studies that have been done out there suggest that if you're buying in the individual market as an individual, you're going to see up to a 73% increase in your health insurance premiums. If you're a small business, up to a 20% increase. Now, the studies vary. I've looked at my state. They break it down, some of these analyses, state by state. In my state of South Dakota, if you're buying in the individual marketplace as an individual, you'd see a 49% increase. If you're buying in the individual marketplace as a family, you'd see a 50% increase. If you're someone who is in a small group market, you'd see smaller increases, but still double-digit increase, 14 to 15% above the normal rate of inflation. In other words, if we do nothing, if we do absolutely nothing, you're going to have normal inflationary increases in health care costs, which I think are hurting a lot of small businesses in this country. But if we do what's being proposed here, it's going to be way worse. Because the overall cost of health care, according to the actuary at the Department of Health and Human Services, the overall cost of health care above and beyond the rate of inflation is going to be $750 billion over 10 years, or a 2.1% increase in overall health care costs. And it translates, as I said earlier, into individuals, small businesses, families paying higher health insurance premiums, higher costs for their health care, higher taxes. If you're among the 185 million Americans, again, who are not in the exchange, who don't get subsidies, you're going to pay higher taxes, and you're going to see your health insurance premiums go up. Now, there are a lot of people, there are a total of 282 million people in this country who are not going to be in the exchange because there are a lot of people who derive their health care through the government, Medicare, Medicaid. So about 282 total million people in this country who don't get subsidies, 18 million who do. And by the way, again, 25 million Americans still not covered. More not covered than would be able to get subsidies through these exchanges to buy insurance. The Democrats are saying, trust us. They said that on the stimulus. They said unemployment wouldn't go above 8%.
The Senator's time has expired.
And I'll wrap up with this, Mr. President. Trust us is not enough for the American people. The American people need real, meaningful health care reform that will drive costs down, not up. These proposals drive it up. I yield the floor.